My name is Mary Hannah Pierce, and I'm a family nurse practitioner student here at Arkansas State University. And this is my poster presentation on the adherence to obesity screening within primary care in accordance to the United States Task Force guidelines. I would like to thank my faculty mentors, Dr. Mark Foster, my advisor, and Dr. Tammy Hawkins, my clinical instructor. My research was based off the United States Task Force guidelines for obesity screening. The U.S. Task Force recommends screening all adults for obesity. Clinicians should offer or refer patients with a BMI of 30 or higher to intensive multi-component behavioral interventions. I chose obesity because obesity has a great effect on morbidity and mortality because it puts people at risk for heart disease, diabetes, stroke, and certain types of cancer. It has increased significantly over the years and is the cause of many health complications. In the United States, obesity affects 38% of the general population. In the state of Missouri, where my research was conducted, obesity affects greater than 35% of people. Many physicians are failing to document obesity as a diagnosis on a patient's chart, and therefore not educating patients on their need for weight management. In a study produced by Fink, the results displayed that 65% of patients with a BMI of 30 or greater were not accompanied with a diagnosis of obesity in the problem list. And with obesity rates rising, healthcare providers need to be educating patients on obesity and making the proper referrals if needed to get these patients help. In recent research, only about 18% of obese patients receive counseling for weight reduction. According to LeBlanc, surveys have indicated that only 38 to 66% of overweight or obese patients have received a diagnosis of overweight or obesity, and less than half of obese patients report that their physician has advised them to lose weight or provided specific information about how to lose the weight. The purpose of my study is to determine the average utilization rate of the U.S. Preventive Service Task Force recommendation on screening obesity patients compared to the national average of 18%. This pie chart represents the national average. 18% represents the patients that are being educated or referred, and the larger section of 82% represents those patients who are not being educated or referred, 18%. The primary objective of the study is to compare the utilization rate of the U.S. Preventive Service Task Force guidelines in the rural clinic with the rate of use among practitioners across the nation. By determining whether the use of this guideline for obesity in a rural clinic is better or worse than the national average, providers at this clinic will gain insight into their performance and have a baseline performance level to use in order to set goals for future improvement. This descriptive study was conducted at a rural Missouri clinic through a retrospective chart review of 50 electronic medical records. Simple mathematical calculations were utilized to determine the percentage of patients who were educated in accordance to the U.S. Task Force guidelines on obesity. My inclusion criteria included male and female patients ages 18 to 65 with the diagnosis of obesity, and my exclusion criteria were age less than 18 or older than 65 and no diagnosis of obesity. The results of my study revealed that 100% of patients aged 18 to 65 are being screened for obesity, but only 32% were provided education or referred for weight management. The pie chart represents this clinic's adherence to the task force guidelines for obesity, where 32% are being educated or referred, and the 68% are not being educated or referred. In comparison to the national average at 18% of adherence to the United States Task Force guidelines for obesity, this rural clinic's rate is higher at 32%. And the graph represents that the rural clinic's adherence rate is 32%, which is much higher than the national average at 18%. When considering the guidelines for obesity screening and management set in place by the task force, practitioners at the clinic involved in the study were found to be better than the national average of 18%. Based on the evidence of available research, providing patients with education and appropriate referral for weight management will decrease our obesity rates in the U.S., therefore decreasing patients' risk factors for heart disease, diabetes, stroke, etc. So more than 60% of these patients are not receiving education or referral on weight management. So there is still significant room for improvement on following these guidelines. So based on these results, it is important for healthcare providers to be mindful of these guidelines set in place and to start educating these patients diagnosed with obesity. And these are my references I used for this research. Thank you.